My name is Laura. I have a son with Prader-Willi syndrome, and we live in Chicagoland.
My name is Kay Mims, and in 2006, I was diagnosed with lupus.
My name's Kevin. I'm from the Chicagoland area. I have focal segmental glomerulosclerosis, and I've had it since 1989. And when I was young, everybody has issues, but there weren't a lot of people I knew who had physical ailments like me. So there was a feeling of isolation, being on dialysis, and an apprehension, and there's an anxiety in that,
I do experience anxiety because I was at a point one time where I didn't know what was going on around me, and I had to depend on other people to even walk.
My son will always have the burden of his disease, and I will help him carry it. It's a lot, and I don't think, moms talk about it all the time, but I don't think healthcare professionals talk about it enough. And what I don't understand is how you can be patient-centered and miss the whole mental health piece.
So to best use the medical system, medical care out there, we have this whole gamut, right? On the very rigorous end, you've got phase 3 clinical studies, which are essential. These are very costly, they're very long, they can be slow, but they're needed to definitively prove something is safe and that it works. On the other hand, you've got individual clinicians with patient encounters all day, and it's just one-on-one.
Well, the difficulty with doctors is, in my experience, they have thousands of patients, but it's hard for them to sift through and find individual situations that match yours.
And there's no ability to kind of aggregate. And so Trend is kind of there in the middle with all this information from social media. And so this type of information then, if gleaned appropriately and organized, can inform both ends of this, right? The clinical studies can be adjusted to what patients are talking about, what's important to them, what these therapies should be aiming to help. And that individual clinician seeing a patient, well, if they know the diagnosis, they know the symptoms, they can look at resources like Trend and say, well, this many people, this proportion have this same symptom, and here are some things that helped them.
I worked with Trend Community, and we identified pediatric neurologists who previously weren't making the connection with narcolepsy and cataplexy and PWS. Trend Community comes up with a lexicon, like what are the different words for sleep? Sleep, passing out, sluggish, fatigue, there's a whole bunch of different words. It turns out that these words for sleep were coming up far more often than were the words around hunger or hyperphagia, which is considered the hallmark feature of PWS.
And so it's not anecdotal, it's not clinical trial, but it does provide this interesting data source that can be used kind of on both ends of the patient care spectrum.
Now, through the use of social media, it's much easier for people to share their stories. It's much easier to link up with a person that has a similar situation as yours and to find out what worked and what didn't work for them.
Social media was a saving grace for me.
We sit down at the computer late at night and we have an online support group, and that happens on social media. And so we talk about how are we feeling? How do we feel about the fact that it's been 3 days since we've been able to? How do we feel about the fact that our child still isn't sleeping through the night?
One of the projects that we did was looking at gout posts from Reddit and Facebook, and we kind of took everything posted on these forums and screened it for any considerations of mental health. I think some of the most interesting findings were around the site of where the gout care took place. If it took place in a primary care office with a doctor the patient probably knew and had some time with, the most common mental health considerations there were trust. Whereas in an emergency room or urgent care site, the most common thing that came up was fear. So the goal is to keep them out of that situation, to keep those gout conversations in the primary care world, where we know that we can make good progress and hopefully prevent that ER visit that we know is not just kind of physical, somatic pain, it's also this kind of mental anguish.
To be able to listen organically in on the conversations and the magic of the shared conversations between individuals about symptoms and presentations over time, and document it and analyze and parse, it's just extraordinary. And that Trend Community is able to extract that data is pretty incredible.
I think I have very good doctors who pay attention to me, who listen to what I tell them, and they try to give me ways to deal with them.
My nephrologist, I spent 10 minutes every 3 to 6 months with them. So there wasn't a lot of mental health. There was just none of that with them, you know. Like I said, they were sympathetic, but that wasn't their part of it.
You know, the anxiety that it provokes to stand up to a healthcare provider or to ask for this level of support from a healthcare provider, a lot of them don't have it. They don't have it in them. They're just, if they can keep their child alive, they wouldn't dare ask for anything more.
Post-COVID, we really understand that it's almost, I mean, it is truly a mental health crisis in the US right now, and people with a chronic disease are doing worse. And so for all those reasons, you know, this part of care should be focused on. It should be kind of brought into the spotlight and acknowledged, which will allow us, you know, as a society, as a medical system, to help people a lot more fully.